We had been fighting sickness in the entire family, and I had lost my voice at one point and had to stop posting videos. Our entire church family was also affected with several cases of walking pneumonia. We were feeling better after several weeks of sickness, but the morning of November 26th, everything changed for the twins.
Both of the twins had been sick, but Benjamin woke up that morning slightly wheezy, and we took him to the urgent care that morning. After asking for a quick history of the onset and performing a quick physical examination, the doctor decided to do the rapid test for flu, RSV, and COVID. He also ordered a chest x-ray to check for pneumonia. After all the tests came back negative, they sent us home with some antibiotics and told us to come back if the symptoms worsened. When I arrived home, I gave him his first dose of antibiotics, and he vomited everything that he had been given. He vomited that first dose of antibiotics and began to cry. He finally fell asleep in my arms after a while, and when he woke up from this nap, his breathing sounded more labored and the wheezing was more pronounced. So we decided to take him to the emergency room at the children's hospital instead. Once we arrived at the ER, they connected him to the monitors at the hospital, and they could see that his oxygen saturation was lower than it needed to be, and they decided to put him on oxygen and monitor him there for a couple of hours. After being on oxygen for a couple of hours, his oxygen saturation was not improving, and his work of breathing was getting more labored. He also was looking very pale, and he had not produced any wet diapers in more than 4 hours. We gave him some fluids in hopes that he would produce some wet diapers, but even after a dose of anti-nausea medicine, he did not keep anything down. So the ER doctor decided to get him admitted for observation and treatment into the PICU. That first night at the hospital was very rough on him. He was on a very high flow oxygen, and he was not very happy and was trying to take it off. Since he was not able to keep anything down, they decided to put an IV on him also. He was given a couple of more doses of anti-nausea medication to help him keep things down. Once he was able to keep fluids down, they decided to also wean him off of oxygen. After 2 unsuccessful tries to wean him off, the doctor ordered a high-frequency vest therapy to help loosen up the mucus in his airways and help him get more oxygen into his lungs. He was able to get 3 sessions with the high-frequency vest, which helped him start weaning off the oxygen. After the 3rd treatment, he was able to be weaned off of oxygen completely and just be on room air. We spent a grand total of 3.5 days in the hospital, including the day of Thanksgiving. He developed stranger anxiety quite strongly after having to deal with multiple people poking at him and suctioning his nose. It took us quite a few days to get him back to trusting people and allowing people to touch his face, but he was able to at least give us a smile at the end. I'm sure both of us are glad to be over with this ordeal.